And welcome back. Well, not every Medicare plan is created equal.
Yeah, and everybody has different needs too, of course, and those needs can change over time, and that's why it's important to have someone in your corner to help you find the best plan and save the most money too. Tom Qualley is the founder of Sovereign Select, an independent insurance agency that offers a wide array of options. Great to see you.
Good to see you.
Hi.
And over the years that you've been on the show, you've been like out there busy saving people money.
You know, I don't know if you've heard, but we've had such high demand that they're actually letting me come on weekly now.
Whoa.
Seriously?
Yeah.
That's going to happen?
Yeah.
Wow.
So,
Good.
yeah, I'm going to be on weekly now.
You know, here's the thing, is it's confusing to navigate all the different plans and to know what's the best option for what you need and your specific health condition and your prescription drugs and everything else.
Yeah, I mean, it's not a one-size-fits-all system. So, you know, it's really important to work with a professional like me or my agents, Sovereign Select. Basically, what we're going to do is each person obviously has a different situation. Health needs, prescription needs, financial needs, you name it, you know, health needs especially. And we're basically going to educate them from the ground up, whether they need a health insurance plan like an Affordable Care Act plan, they're, you know, losing coverage from work, or they're changing careers, or they're over 50 and they're starting a business. We can actually help them, you know, figure out their specific situation and what type of plan from which company is going to be absolutely the best. If they're going on to Medicare, we walk them right through it. Part A, Part B, Medicare Supplements, prescription drug plans, Medicare Advantage plans, educate them on all of that and really just kind of help them customize a plan that works for their specific situation.
And a lot of people who are already on those plans, you really do help them save a lot of money, especially on people who've had their Medicare supplement coverage. That's really the place that you can kind of dig in and find extra dollars from people that they didn't know were available to them, right?
Yeah, you know, last time I was on, I told you a story about when I saved a woman, actually the day before, $3,500 for the year.
Huge.
It's a lot.
So with me and my agents, we've actually, since the last show, we've probably averaged savings per person about $600 to $1,500 per person.
That's a lot of money.
And it's happened quite a few times. So it's very important to be proactive and call in and review your plan. And like the last show I said, review your plan every 3 to 5 years.
Okay.
And that absolutely is true. And if you're beyond that, it's, you know, it's time to call.
Are people aware of the fact that you can also have supplements to help pay the co-pays?
On Medicare Advantage plans, yeah, so that's another thing. You can actually buy supplemental plans. They're called hospital indemnity plans or critical illness plans that actually help supplement some of the co-payments, like the higher cost co-payments like hospitalizations and surgeries within your Medicare Advantage plan.
Do they
which
work
are the
if you're
most
already
expensive parts.
if you're already having surgeries and things? Can you still add those on?
Well, like any other insurance, you want to buy it before you need it. So you definitely want to call ahead and get it before you actually need it. I actually had a person call the other day and said, well, I'm having a surgery next month. Can I get this, you know, extra coverage? And, you know, unfortunately, you're not able to if you have something coming up that you already know about. So you want to get it done before you actually need it. And for the price, it's definitely worth it.
Every month people turn 65. Some people are going to be 65 maybe in the coming months. What is it that you recommend that they do?
Shop around, you know, and you can shop around with 40 different insurance agents, 50 different insurance agents that work for specific companies. You know, you could go to company 1, 2, 3, 4, 5 individually and hear everybody's pitch. We're independent, so we actually carry all of those companies or at least have access to all of those companies. So what we're able to do is clients are able to meet with one person and see all the companies, all the plans, all the options, all in one place. So instead of spending hours and days and weeks, you know, researching and going from company to company, you just come to one place, and it takes about an hour.
Well, and it's confusing. You know, I think it's so confusing to do that, keep it all straight, and there's so many different things within these plans. The Affordable Care Act, even though the enrollment period is over, what do you want to say to people about that who maybe didn't get coverage or have it, maybe want to change in the future?
When with the Affordable Care Act, since the open enrollment period is over, there's only certain time periods or certain situations that people can actually change their plan. They're called special election periods or special enrollment periods, which is like a person that's losing their job, losing coverage from work. They might be expecting a child, getting married, divorced, moving. They might move to a different area, or if they're moving into the Milwaukee area, they could be eligible to change their plan and get a new plan.
I think it's wonderful that you're willing to meet with people in their home, at your office, with whatever's most comfortable and convenient for them. And keep in mind, you don't pay Tom for his services or to compare plans. That's a service that's free to people because you work with all of these different agencies and groups. So contact Tom and the good people at Sovereign Select. The phone number is 262-641-4111. You can also Google Sovereign Select or visit their website, which is Sovereign Select, INS for insurance, INS.com. Great
Thanks,
to see
Tommy.
you.
Thank you.
Keep saving people money.
Yeah.
Yes,
that's your
We're
job.
just going to keep doing that.
Thank
See you
you
again
so
soon.
It's been
much.
working so far.
Yeah, absolutely. Great to see you.